Good afternoon once again, ladies and gentlemen. I think we can begin. I'd like to welcome you all to this wonderful session where we are going to be exploring the role of emotional intelligence in the healthcare industry. We have an absolutely stellar panel that are going to be sharing their experiences and sharing their insights into this very important topic, particularly with what is happening in the current environment. My name is Bbanga. I am humbled to be your host and your moderator for today. My job is simple, is to make sure that our panelists can shine and give as much insight as possible into this topic. I would like to bring in or introduce the CEO of Profiles International. Her name is Vicky Karuga. And Vicky, I'll just give you a few minutes to give a few opening remarks. Vicky, karibu.
Thank you very much, Derek. And thank you very much to our panelists for agreeing to be part of this discussion that speaks to why emotional intelligence is important to healthcare. As you know, we're running the hashtag today called EI Works on Emotional Intelligent Works. Should you have anything to say on social media, you can use the hashtags EI Works or Mold a Culture. And you can also tag the speakers as well as Profiles International. And that information will be given to you on the chat as we go along. But it is my sincere hope that you will enjoy both the session and that it will be very informative for you. Thank you, Derek.
Thank you, Vicky. So let me repeat that again, just in case everybody didn't get it. We have two hashtags going on, EI Works and hashtag Mold a Culture, for those of you who can multitask and are active on social media. Personally, I can't, but we do encourage you to do that. The chat will be open throughout the duration of this conversation. So we are going to encourage you to share with us your questions, your ideas, your feedback, your insight. We would love to get you participating and interacting with our panelists. I would also like you just to, for the sake of the integrity of this meeting, to put your microphones on mute. If the occasion calls for it, we may unmute you just to hear you speak or to allow you to interact with our panelists today. So once again, let me welcome you all to this wonderful conversation. We said that this will take about an hour and a half. Hopefully we'll be able to have as much insight during this particular time period. So without any further ado, I'd like to introduce, as I said, our esteemed panel of experts. And I'm going to start off by introducing a lady by the name of Nancy Mwabili. She's the Chief Human Resources Officer at the Nairobi Women's Hospital. She's also a certified GENOS emotional experience practitioner. So she will be approaching this topic from both those angles. Nancy, karibu. With us also, we have from Tanzania, Brenda Msangi, who is a Tanzanian health executive. She's also the CEO of Comprehensive Community-Based Rehabilitation Tanzania, also known as CCBRT. We value your time with us today, Brenda. Thank you. And karibu sana.
Thank you.
And also from Tanzania, we have Mili Rughani, who's the head of business development East Africa at the Aga Khan Hospital Services in Tanzania. So she will certainly be sharing with us her insight, particularly from an administrative perspective. So Mili, karibu sana.
Asante, asante sana.
And with us also, we have an experienced health services executive and leader with over 20 years experience as a top executive in the healthcare industry. Those of you from Kenya, I'm sure this name will not be strange to you. Mr. Gordon Odundo is with us today. Gordon, karibu sana.
Thank you, Derek. Happy to be here. Thank you.
Fantastic. And I just want to double check. We were supposed to have Carol Nviwa, who is a neurologist specializing in female urology. I'm not sure if Carol, Dr. Nviwa, is with us, but I'm sure she will join us just as soon as we can. All right, ladies and gentlemen, let's get the ball rolling. Before I do that, I just want to talk a little bit about emotional intelligence. As an emotional intelligence practitioner myself, this is a topic that is near and dear to me. And to me, it's important, particularly, as I said, in the environment we find ourselves in, where it is important to pay attention to how we feel and begin to act a little bit more intentionally with our emotions. In fact, Genos, the organization with which I am a practitioner with, gives the definition of emotional intelligence as the skill to better perceive, to express, and to manage your emotions. Perceive, express, and manage your emotions, and not allowing our emotions to hijack us and take control. So, does emotional intelligence matter in the healthcare industry as it does in other industries? I'm going to ask Nancy to take the first swipe at the ball. Does emotional intelligence matter?
Thank you so much, Derek, and thank you everyone who's joined us today. In my understanding of emotional intelligence, as Derek has given us a brief introduction, it's the capability of us being able to perceive and take charge of our emotions, and of course, being able to perceive the emotions of others. So emotional intelligence, it has been rated as one of the top skills that is required for success. And I know that has become much more critical at such a time when we are having these aspects of course, we are social distancing. There's a lot of artificial intelligence that has come into play. And just as it is important in every other sector, when it comes to the healthcare sector, emotional intelligence becomes very key. Because of course we see healthcare sector, it is a service industry. And when you think about a healthcare setting, it's perceived to be a safe haven. It is a place of healing. It is a place where you expect to come and find people who have a very good understanding, because you're coming into a health center setting, because you are in turmoil, you are in a crisis. There's a lot of anxiety you have as a patient. And when I look at a healthcare setting, there's a play of very many different parts that are moving at the same time. Because we see a healthcare setting, being a professional in a healthcare setting, there's a team of different professionals who have to depend on each other. Their patients, their relatives to these patients. Sometimes there's even a third party who is a payer. So for healthcare, then it becomes very key when you're thinking especially about self-awareness and awareness of others and emotional reasoning and being able to make rational decisions. So in as much as emotional intelligence is key in every other sector, the aspect of empathy then stands out for emotional intelligence in a healthcare sector.
All right, Nancy, sorry, I don't mean to interrupt you. I know that we're going to get into the meat of this, so I want you just to hold your horses as we are going to explore some of those competencies like empathy and self-awareness. Thank you for that very comprehensive answer, Nancy. Asante sana. I'm going to swing the bat over to Brenda. In Tanzania, does EI matter? Is it important in the healthcare industry, and why?
Absolutely. I mean, if there's one most important social skill in healthcare, it's definitely emotional intelligence. I would like to put a bit of another perspective to this. A skilled emotional intelligent person is a person who can, first of all, identify emotions, then use those emotions, understand them, and then regulate them, right? Now, hospitals can be very stressful, can be a very stressful environment. You can see that from healthcare providers to the patients, whether it's doctors and patients or nurses and patients, or even sometimes between the healthcare providers themselves, because there's a lot of egos there. So there's a lot of emotions usually in a hospital setting. Now, if these emotions are not properly regulated, you might make some serious mistakes. So a lot of research is done when it comes to emotional intelligence in healthcare setup. And it's actually one of the key factors that separates a most effective or most successful medical organizations. And there are a lot of examples. One of the key aspects of this is a good relationship between a doctor and a patient. Once that is right, many things follow. For example, I mean, I remember when I was a pharmacist, you'll get a prescription, a patient comes with a prescription and they tell you, I hate tablets. And you're thinking, okay, you see tablets on the prescription. How come the doctor did not know that these guys hate tablets? They could have prescribed a liquid form of the said medication. So what happens is the patient will not be compliant, and then recovery will be very slow. So one of the things is that the two has to work together, the doctor and the patient. Nancy spoke very well in terms of empathy. The area that I work with, it's a specialized hospital. Doctors have sometimes to deliver very tough messages to the patient. Mm-hmm. Imagine this patient who has glaucoma or some degenerative eye problems. They have to break the news that, guess what, you'll most likely not be able to see. So all those emotions is a person that, first of all, you have to manage your emotions, but also emotions of those surrounding you. Or whether it's a patient with fistula, for example, they have complex emotions. So for you to be able to provide that patient-centered care, it's very important to ensure that those emotions are important. But also for us as leaders, EQ in healthcare, leadership is crucial, because we can only be effective if we have high emotional intelligence. We can understand our staff. I can give you another example of COVID. When COVID stepped in Tanzania, the first reaction from my doctors, it was panic mode. You know, they literally was like, okay, they've seen so many deaths rates in Europe and US, and there are the frontliners. So that emotion, it was for us leaders to identify what that emotion was, and that was fear. So once we had promised them and ensure them we'll keep them safe by giving them PPE, then they come down and they were there to provide service. So I cannot emphasize the role of emotional intelligence in healthcare.
Okay, that's a very comprehensive answer, Brenda, and you're very sure about that. You talked about world-class organizations in the healthcare industry that focus on emotional intelligence. You also talked about leadership. We have two leaders right here on our panel. Let me start off with Mili Rughani, Aga Khan Hospital, a world-class organization. You're a leader there. Is EI important? And if so, why?
Thank you, Derek, for the question. Absolutely. I think emotional intelligence, which we call it EI, if I remember a few years back, it was not important. It was good to have, but not an essential. And now in today's world, it is the important feature that any organization would have, now more so as a health sector as well. So just to give you a context, so Harvard Business Review shared a quote saying that in hard times, the soft stuff goes away. And emotional intelligence isn't soft. That's why it has stayed back in the hard times, which says a lot. Which means that in few years, not even very long ago, few years back, it has been said that emotional intelligence is a soft part of the person. Emotions are the soft part of the person. Whereas in today's world, we are actually trying to capitalize who understands the soft part of the thing of the person and then react on it. And that's where the self-awareness bit comes in. If you are self-aware, only then you will be able to attend to the patients, listen to the patients, and the qualities that a self-awareness leader or a staff or a frontliner would definitely have features like they will be able to, the decision making will be much more rational, will have the ability to even study the patient in much calmer way, because they have control on their own emotions before even react to that. As Brenda mentioned, COVID-19 hit us, and exactly what happened in Aga Khan as well. All our doctors had taken a step back and thinking, okay, what do we do? Because we were so scared, and self-awareness is what brought us back, saying yes, but we are scared, we are here, however we still need to do what we need to do, and giving the confidence that we are here to give them everything that is needed. Also, with the self-awareness, having self-awareness within you, you can be better communicator. Once you know once you understand what you are, you start communicating better, you get better results, and overall gives a better perspective. So yes, emotional intelligence is very, very, very critical in whatever organization it is, whether it is a health sector, whether it's banking, whether it is education. I'm sure you have also heard that education is going to shift complete gears out of the situation. So to my last statement, very important for health sector, because we are in the midst of a lot of things that is done emotionally.
Thank you, Mili. And I love that you double down on self-awareness. To me, that is the opening of emotional intelligence. It is the gateway. So I'm going to ask Gordon, who's had many, many years as a leader in the healthcare industry, particularly when it comes to self-awareness as a leader, but the general topic of EI in the healthcare industry. What are your thoughts?
Thank you, Derek. This topic of emotional intelligence or EQ is actually very, very core to my beliefs. And even before people started calling it that, I realized that was actually the key thing to succeed as a healthcare leader. And like you're seeing and hearing, our environment is a very, very fluid and dynamic environment. And I learned very fast, having come from the hospitality sector, while we needed to invest in EQ, for instance, and highlight it in our training. So when we watch series, we used to watch on TV, we used to have the emergency room series, George Clooney, and I was in a different industry. I thought that there's a lot of urgency, sense of urgency in healthcare. And I actually found it was the other way around. Having come from hospitality, where we're more customer-centric, customer-focused, it's an urgent thing. Healthcare, by nature, by training and all that kind of thing, does not inculcate a culture of urgency. And if you translate that to the EQ philosophy, it means that the healthcare workers need to translate themselves and put themselves in the patient's shoes. I may have a headache, it may not kill me, or have a fracture, but it's something that maybe needs a painkiller. Or the patient, to them, that's really the most critical and most important aspects of whatever it is that they're doing. So you've got to start by inculcating in the leadership. How do we lead from the heart? And it's easy to say, but really, really hard to do. So you've got to inculcate the factors that let people lead from the heart. Another major aspect of that is people work long hours. They don't have breaks. They work nights. We work 24 hours, 7 days a week. And what tends to happen is that we forget to manage ourselves. So the rate of burnout tends to be extremely high, mental illness among healthcare workers, among many, many, many other problems. So again, inculcating a wellness program, and wellness in my case, it does not mean only keeping fit. It talks about the emotional, the spiritual, all aspects of our healthcare workers being very, very, very critical. Talked to, but not really carefully highlighted, is relationship management. hospitals are complex in the kind of stakeholders that we have in our environment. If you have a sick person, that person is not the only one ill. We have many visitors, relatives, friends who come to see that person. So we have to manage the entire spectrum of that. Then you have the healthcare workers. And what I'd like to emphasize is that unlike other industries, health sector has got the highest number of highly intelligent and highly trained people. Even if you start from doctors, consultants, nurses, the people in the laboratory, the people in the pharmacy, every 2/3 of the workforce are diploma or higher tertiary learning trained people. And those are not the kind of people that you could work with because they also work with their intellect. Unfortunately for all of us, we realize that social skills are not trained to these highly skilled, highly professional people. And that becomes a weak point in trying to engage your customers and give the highest level of service delivery that you have. As a leader, what I was able to learn a lot is how do I show empathy with the patients? How do I show empathy with my senior leadership team? And how do I show empathy with the general staff population? And what was really critical to me and my leadership team is how we're able to handle problems. If we showed very good EI, we'd actually approach problems with a very clear, open mind, not from our own perspective or personal perspectives, but in a more interactive and build relationships and partnerships. And that kind of partnership would go throughout the organization. So basically our leadership team, the clinicians, the healthcare workers providing the work, and the administration, and thereby the institution would be very, very successful. So it is extremely critical to embed EI in healthcare leadership. Thank you.
I mean, Gordon, you have said so much just in that brief 5 or 6 minutes. So many points that are actually going to tether our conversation today. So thank you for that comprehensive answer. I'm going to pick 2. You mentioned leading from the heart. You mentioned inculcating wellness. And there's that word again, empathy. So Nancy, you introduced empathy. Gordon's talking about empathy. Nancy, what happens to an organization, a healthcare organization that has staff who lack empathy? What are the implications? How does it affect the roles that are being carried out? Could you talk to that or speak to that?
Thank you so much, Derek. I think as my colleagues have highlighted, there are several relationships, even as you think about empathy, that here we are talking about. There's relationship between co-workers. There's relationship between the care provider and the patient. And empathy is important all through, because when it comes to colleagues as care workers, if someone is not empathetic, if you're not aware of others and feel them and put yourself in their shoes, you may not really be able to respond appropriately in as far as harnessing emotions and making the right judgment is concerned. Because look at a healthcare system or a healthcare facility as a supply chain, where someone is coming all the way from reception, you're turning on someone to the next person to be able to serve them, because we're a service business, so to say. And it is not when a patient comes in, they're not just interacting with one person, they're interacting with many different people. So as co-workers and as colleagues in healthcare, and I think it's Brenda who spoke about some egos that sometimes are there and some very major sensitivities within healthcare. If you're not able to understand what your colleague is going through and be able to feel them, I think I'm repeating myself there, then you won't be able to respond appropriately. When it comes to the side of a patient has come. I think I started by saying that a hospital is a safe haven. Someone is already sick, someone is anxious, they're somewhere waiting for lab results. They definitely don't know what is happening with them. And they come to a doctor. A patient needs information and empathy for care providers. If I'm to think about then that relationship between a care provider and the patient, having that attribute of empathy then improves on the patient-centered care, because a patient has need for information and the healthcare provider needs to be able to view also the patient as a whole person. So empathy then comes in very key as far as then that relationship between the patient and the service provider is concerned, and it would improve significantly, it would impact significantly on patient-centered care.
Thank you. Thank you for that answer, Nancy. Let me just go over to Brenda. So Brenda, do you see EI training for health professionals impacting, I don't know, patient-centered outcomes? I think that's the terminology used in the healthcare industry, or the lack of impacting them adversely? What are your thoughts?
Absolutely. I think, I know more awareness is definitely coming up now, as what Mili said, comparing to previous years. So this is something that now is becoming more and more a necessity, especially when it comes to healthcare providers, especially the medics. As I'm repeating myself, that this is one of the key social skill needed to provide good quality healthcare services. Now, there's one thing I want to add in terms of leaders, and that is decision-making and how EQ can impact, whether it's a healthcare provider or even a leader in a healthcare organization. As you all know, us as human beings, we have two minds. We have the rational one and we have the emotional one. Mm-hmm. And they both, they do work in harmony for you to make a decision. So when there's passion or where there's stress or where the emotions are high, the emotional mind takes over. And sometimes you make a decision based on emotions before the rational mind has time to react. So this is where as well, you see that how EQ is crucial in decision-making, whether in coming up with treatment plans or even leadership when you're making decision within the organization.
Brenda, thank you so much. And I love what you said about the emotional mind and the thinking part of our brains. My understanding, particularly in how we process emotions, is that the emotional part of our brain, which includes, areas of the brain like the amygdala, and then it interacts with the prefrontal cortex over here, and then tend to make decisions based on that immediate emotion, particularly strong emotion. So thank you very much for highlighting some interference. I hope that's not coming from my end. If my colleagues could perhaps look into that. But Mili, I wanted to ask you, I mean, you work in business development, you've had leadership positions, you're there at the Aga Khan Hospital. Do you look at emotional intelligence as part of your recruiting or a recruitment tool when you are bringing healthcare professionals into your organization? What are your thoughts about that?
Absolutely, Derek. And I think the question is a yes. And I think I will go a step back. Before I joined Aga Khan, where I was a CEO of a recruiting company, and we hired more than 7,000 people in 1 year. And the exciting part and the different part is that where we started, emotional intelligence was not paid attention again, but now 80% of the attention is actually given to the emotional intelligence, and it is proven over the performance that that people who have emotional intelligence as the biggest feature into them have been more successful in the business perspective in any role they are doing, and more so it also impacts the health sector, because remember, health is again something that is go into a very stressful environment, and if you who has an emotional intelligence would be able to manage your emotions, manage your anxiety, and be able to communicate well with the patients, that's a win-win. And the health sector really spends a lot of time in taking note and making sure that emotional intelligence is the biggest part of hiring in health sector. But I would also say that nowadays it's not just health sector, Derek. It's across the board. People who are high in IQ have a good communication skills, who has better teams, who are better leaders, and that has been proven across in various researches that has been done.
Fantastic, thank you, Mili. I couldn't agree more. Gordon, I know you, with your leadership experience, but what are some of the areas in leadership where we see either low or high levels of emotional intelligence, and what is the impact, particularly at that level?
I think, because I led organizations for more than 15 years at the top, and our ego actually is the biggest detriment to all of us. So you can imagine dealing with the top cardiac surgeon or cardiologist in the region, and well, he's got an ego to high heaven, and you have to be able to negotiate and placate the person without having the egos coming into play. And it's a skill set that you eventually learn, because you don't want always to have a confrontational situation with dealing with these highly competent, highly skilled individuals. A very quick learning is to allow healthy debate in the workplace. So my very early experience dealing with highly intelligent people who actually didn't have this self-awareness is going into meetings, and a certain very strong position would be pushed with a very narrow interest. And we would go back and say, okay, let's develop a policy which will allow certain procedures to be done by certain people with certain expertise within our hospital. And after 3 weeks of hard work, when it was presented, the same individual who highly skilled and professional in that area would turn around and vehemently oppose a recommendation that made. And then you realize that with highly intelligent people, you must, with your EQ, you don't get frustrated. You learn that is part of the process of them being aware of the issues and moving away from pushing a personal agenda. It may not be very apparent at the beginning, and people may throw toys and everything. A way to be able to do that as leadership is actually to develop programs of soft skills training. So you would bring those people who were very good technical expertise, and through organized training, create that self-awareness, the self-management abilities in them, and the empathetic skills. And let me give a very simple example about empathy. In healthcare, pain is normal. Yeah. You go through painful procedures, you come to hospitals in pain. Pain is the sense of everything, to an extent that healthcare workers are sort of mute to pain. So how do you train healthcare workers to be sensitive, to be able to alleviate pain and painful procedures? And this goes above from my time as in a children's hospital, to the extent that children would love to go and see the dentist. The dentist was their friend, and they would not see the dental reviews every 6 months as an experience to avoid. It is something that they remind their parents and say, oh, it's time for us to go for our dental appointments. So that's by creating empathy, creating leadership from the heart, that people put themselves in the other person's shoe and they're able to actually get it about. I want to touch about communication, Derek. Because scientists are not good at communicating, they will run into trouble. So the most important thing is actually to offer them skills training, which allows them to be able to present a very detailed concept into a very simple poster, which will be very understood. And that comes from developing their emotional intelligence skills. Thank you.
All right, Gordon. You're talking to the choir here. I'm sold. I'm all in when it comes to EI. Let me push back a little bit and on a brief answer from you. So I can understand empathy from a front office professional or frontline healthcare worker. That goes without saying. I would imagine that you have to have empathy for somebody who comes into your facility who's in pain. But as a leader, and you have been there, when you're there having to battle with vendors, having to battle with the board of directors, having to battle with supply chains, all of that, really? This softer side is what you're saying, as somebody particularly in the healthcare industry, is what is needed from leaders?
Yes.
I would think more your technical management skills are the ones which will see you succeed?
You know, in healthcare, you're very lucky to have the best brains around you. You know, like I mentioned, you've got the top neurosurgeon, top cardiologist, top pediatrician. So you're not lacking in intellect to help you do your work. What we really don't have is a connectivity. And I can share a very good example. In one of the organizations I was leading, we tried to ask, why do people come to us? And the most obvious answer is going to be, oh, they come for treatment, we're the best in this, we can do all these procedures, we're quick, we're efficient. Do you know, with our EQ skills and everything developed, we actually summarized it to a very simple phrase, Derek. People with children who are very ill, actually sometimes more stressed than the children. And if we could give them peace of mind, then we will succeed. And in the end, everybody understood that the product we're selling was actually peace of mind. And that's what was behind my success. As simple as that.
All right.
Very complex though.
Thank you, Gordon. You have cleared that up. So folks, just to remind you and encourage you, we'd love to hear your thoughts. We would love to hear your feedback. Any ideas that you have, please kindly go into the chat. I'm sure everybody now is familiar with this platform that we're using, Zoom. You can go into the chat and put in your questions, ideas, and feedback and thoughts there. We also have two hashtags that are going on. We have EI Works and hashtag Mold a Culture. So as we are gathering our collective breaths due to all of this information that our esteemed panel has shared with us, I'm going to bring Brenda back into this conversation by asking you, Brenda, can you talk a little bit about this burnout that people, particularly in your industry, go through? What has been your experience with the most common gap that they face? And particularly in this environment when they're giving so much, you know, you're dealing with these, you know, cases day in and day out. What do you have to say about that?
Sorry, Derek, I missed the first bit you broke off there. Can you repeat the question, please?
Oh yeah, sure. I was talking about burnout that people in
burnout, yeah.
And particularly in this environment, what is your experience there, or what would you be able to comment on that?
This is where now also empathy comes, right? Mm-hmm. Where you're also very cognitive or very self-aware of those who are surrounding you. You need to pick up those emotions and you need to make decisions when you identify those emotions. And I think sometimes as leaders, sometimes we don't put ourselves in the shoes of those who are doing the work. So, and then if there's poor communication, because one of the things of high EQ is great or increased communication. So increased communication then ensures all parties are on the same page, whether it's from patient to doctors or healthcare providers themselves or staff and leadership. So once there is empathy and there is high EQ where everybody is very empathetic with the other's emotions, then it's easy to have that communication, be open about it, and allow them to open up and to be on the same page to say, okay, listen, something needs to change, and to be open about it. And one thing that I also want to say, there's this aspect of, you know, leaders are always right. And it's almost kind of, it's engraved when even university scholars have that, it's very top down, that you cannot challenge your leader. You cannot dare to ask questions, or leaders are not humble enough to, you know, to kind of seek that feedback back. So I think that's where, again, emotional EQ is very crucial, and to pick up those issues before they get to a stage where there's burnout.
Okay, thanks for that. Clearly, communication is one of the things that is topmost when it comes to emotional intelligence and to prevent things like burnout. Mili, what are some of the areas in patient care that you think healthcare professionals need to work on, and particularly when there's low emotional intelligence? So just as a matter of my own personal experience with doctors that I have been to, it's almost like I am a number when you go see that doctor. There is, I mean, literally, you're called in, you're asked what your symptoms are, the doctor barely looks at you, gives their, their sort of analysis, you know, recommends you a few tabs to take, and you're on your way. You're in, you're out. Can you talk a little bit about that?
Sure, Derek. I think patient care, what you're saying is definitely true, that it feels like a number when you're going to a clinic and doctors have only 2 minutes to talk to you. And that's why I'll go a step forward and talk about what the future looks like, and how emotional intelligence have created artificial intelligence, which then helps to overcome the gap between the two. In around the world during this COVID period, to manage it, the world have started something called teleconsultation, and it is not something new. It has been happening over the years. In that, because of the artificial intelligence that we capture during the teleconsultation, there's an emotional connection that happens between the patients and the chatbot or the robotics who are sitting behind, and we are capturing the artificial intelligence. What happens in that case is that somebody calls and the robot is either answering, or the nurse that is answering, which is there to answer and have a teleconsultation with you for a number of times that you want. That gives a support to the patient, which gives emotional support to the patients. Also, technology, as you go, has also created human-centric designs, right? Which helps to understand what are the needs of the patient. Which reminds me, if there is a patient who has come a week back, had a surgery done, and again, the artificial intelligence will pick up that and send a message. Hey ma'am, hey sir, how are you feeling? The emotion, that part connects with the emotional so well with the patient. Nevertheless, whether it is done by technology or by a person.
No, sorry, go ahead, Mili. I didn't mean to interrupt you. Go ahead.
Yeah. So what I was trying to say is that emotional intelligence has now graduated into artificial intelligence. Combined together is giving a perfect patient care that is needed across the world. That's what my ending statement was.
You've actually said something that I wanted us to get into deeper. Now that you've brought it up, I would like to share with everybody on this panel a clip that I pulled up, and I hope everybody can see that, of something very interesting that's happening in one of our neighboring countries, Rwanda. It's a short clip. If everyone can please watch this.
Also our files, because the virus can remain on the papers.
Good afternoon, resident representative of UNDP Rwanda, representative of Ministry of ICT and Innovation, representative of Ministry of Health, South Korea, Switzerland, Netherlands, Belgium, and China, where corona.
They will help, especially health professionals who are here, in taking some of their duties and therefore being less exposed to be infected by COVID patients who are here.
We have a local subsidiary, Zora Robots Rwanda. It's led by two Rwandan technicians. They have a team that is dealing on the maintenance part for these robots when it's needed, but they have a larger team that is going to put in place the robotics academy, where we're really looking to expose the younger children to robotics and get them excited about it as we build more skills in the STEM fields for the country.
Okay, I hope everybody was able to see that. So, Mili, you brought up this topic. I've shown you the clip, and it's been known that, AI, artificial intelligence, automation, robotics has been, it's going to change the market force, workforces in the healthcare industry, particularly, whether it's with helping with the labor shortage or, cushioning frontliners against highly infectious diseases. Can artificial intelligence replace emotional intelligence? Is that what you were alluding to earlier?
I would not say replace, but I would say complement. So AI and EI works together and complements each other. So there's definitely no replacements to the humans, but with them working together, clearly it develops that room, that relationships, that trust, that proactiveness which is needed, that time which is needed. As you mentioned, Derek, that you've gone to the doctor and you've sat and the doctor doesn't have time to talk to you even more than 2 minutes, and you're thinking that he said, oh, I waited for so long and that's it. I mean, I've been in that situation. I'm sure we all have been in that situation. But with technology, that gap is been trying to overcome by building that relationship with the artificial intelligence, Derek.
Okay, thank you for that. And Nancy, so you're at the Nairobi Women's Hospital. Have you seen artificial intelligence work there? And particularly, how does it work with emotional intelligence? Nancy, what can you say? Or your thoughts about it in general? Yeah, go for it.
Thank you, Derek, for that. I think I'll comment as a professional because I'm not necessarily speaking for the hospital, but where I have seen a reduction of human interface is, for example, what many of us have gone into as far as telemedicine is concerned, and I know my colleague has spoken about that, where you are not directly interacting with the patient, but the patient dials in, which would be comparable to what you have just shown us in that clip. But to get into your question, in as much as artificial intelligence, we are trying to get into some robotics, which would read into human emotions. My sense is that it cannot 100% complement emotional intelligence, because there's an extent to which a robot cannot get into. True, we are setting robotics to read emotions, but at that point of direct relationship, a caregiver can be able to take it a step further. And for instance, get to know the circumstances surrounding a patient, which then would help a patient make a more informed decision as far as the treatment options are concerned. I'm thinking about aspects, because we see a patient is a total person. There's the disease that is presenting. There's also, for instance, a capability to pay. That is something, so a robot will be able to pick the feeling of that the patient is having. But some of those social aspects that are very key and play a major part as far as the treatment journey is concerned may not be picked by emotional intelligence. And therefore, even with the rise of AI, to me, it makes AI even more important. It makes the need for AI more pronounced. Of course, in the past, we couldn't imagine a patient seeing a doctor without a face-to-face interaction. And at the advent of artificial intelligence, my conviction is that the professionals who are going to stick more, to remain more relevant, are those who have skills and capabilities that AI, cannot be able to replicate. Those who are more understanding, because I'll come to you, I can't go to a robot and tell them that I'm not able to pay, and therefore you're able to present to me different options. You cannot be encouraged, but AI cannot be able to encourage a patient and to motivate them and to give them some hope, which is part of what is needed so much as part of a healing journey. A patient needs to get some reassurance. A patient needs to be motivated and to be encouraged as an integral part of the healing journey. And therefore, to me, Derek, to answer your question and to summarize, even with the advent of AI, it cannot substitute EI. It cannot EI, sorry. EI still is very key and important.
That's a definitive answer if ever I heard one, Nancy. Thank you very much. All right, I'm going to the chat, guys. I can see a few of you have posted something. Dr. Sheila Masharia, reality, you don't get EI by knowing it's important. Training is fine, but what does it take to change? Gordon, what does it take to change?
Derek, that is the fundamental question in terms of what makes people actually fail or succeed in whatever it is that they're doing. And it always boils down to very, very simple things. Like if you know that what lets you down is your lack of emotional intelligence, as it were, then it means that you need to work a lot more on your self-awareness in that particular aspect and be more reflective. I think every time you demonstrate arrogance or lack of empathy in whatever it is you do, you should be, your self-awareness should draw it to the fact and say, I did not handle that very well. How should I handle that better? And that will stop limiting you from progressing. People's careers have actually been stopped. And I know very many people who are exceptionally gifted, but they can't move the next level because of their lack of EI. And also, the most important thing, we didn't talk about it, we hardly mentioned it, is the aspect of social management being a major aspect of EI. In our field, particularly in healthcare, it's very easy to immerse yourself into your work, you're saving lives, and be extremely socially awkward to the extent that the words people use that I don't like socializing. But it is known that for you to get ahead, your social network and how you manage yourselves away from professional work is actually more critical sometimes to even the way you perform at work. And it draws back again to what I've said, self-awareness of that limitation. So you have to learn the skills of enjoying being in the company of strangers, interacting with people you would generally not disregard, drawing out the human character, whether you meet a waiter, a watchman, or a cleaner in your building. And I have seen recently, actually, it's very interesting, somebody failed to get a job because despite them answering all the online questions for the interview, they will ask a very simple question. What is the name of the guy who cleans your offices every day? And this person had worked there for several years and they had never bothered to ask that person their name. So that actually showed lack of empathy, lack of understanding, and it limited their ability to get the job they strongly desired. Thank you.
Yeah, I completely agree with everything that you've said. You know, as part of this conversation, we have people who are in this meeting who are experts in the area of emotional intelligence. So we have Madam Zuhura from Tanzania. She says emotional intelligence skills are learnable skills. We're all born with some level of EI, but due to the fast pace in our work and in life in general, we fall into a subconscious expression of how we show up and be experienced by others. And I think that ties in a little bit with what I'm saying earlier, is that we need to be more intentional, particularly with our self-expression. And Harriet agrees. She says EI is about self-knowledge, about self-awareness. Are we brave enough to see ourselves as we really are? And there's Ismail from Uganda also says the expression of good emotional intelligence in the expression of good emotional intelligence, actually, this is a question. How do you advise a subordinate to deal with a supervisor who has low empathy? And I'm going to open this up to the entire panel. Who would like to take this? How do you advise a subordinate to deal with a supervisor who has low empathy? Who would like to take that?
I think Derek, having been there at the top and having tried to change the culture as a leader, I can give a very simple example from a leader's perspective. To break that ice and to be more empathetic is develop a culture where every other employee greets everybody they meet. So if you're walking down the corridor and you meet somebody, it's a polite nod of the head, good morning, good afternoon. That breaks the ice. So this subordinate should try together with their colleagues to develop that culture themselves, where outside the leader's circle, you've got to break the ice so people can ask about each other. So let me give simple examples of big organizations. How do you demonstrate empathy? By developing subcultures in departments of celebrating birthdays. If somebody's bereaved, supporting them, whether it's emotionally or being there with them, and sharing life's journeys because you're together at work. So I think eventually it will be a contagion that the leaders who demonstrate lack of empathy will either have to join in or ship out. I think that's the way to go.
Okay, thank you for that. Harriet further goes on to say that the challenge in healthcare is that patients are seen as commodities. How do you change this perception? Mili, Brenda, how do you change the perception that patients are commodities?
I can start off and then Mili can come through. I think.
Go for it.
Let's also talk about the importance of EQ in business, in running a business, right? It has to be understood that EQ plays a very important role, even how cost effective you become. And that relationship or the outcome of treatment, for example, between that relationship between a doctor and a patient is crucial. So I want also to go back to what Gordon was saying, and then I'll come back to this, Derek, if you may allow me. On the question, I think, was it Kaiser Ismail asked about a subordinate who wants to deal with a supervisor?
A supervisor has low empathy. Yeah.
So one of the things, how you create a change in culture, culture comes from behavior comes from systems. So sometimes setting up systems may influence the behavior of staff or of colleagues, and then culture will start building up. And this is a process, and it takes time and practice. So for example, here at CCBRT, we have what we call huddling. So every morning before the team start doing whatever they're doing, we huddle. We huddle for not more than 10 minutes. And it's not a meeting. We all stand up in your department. It doesn't matter whether you're a cleaner, you're a doctor, you're a nurse, where your work environment is, you're free to bring up anything, whether it's a problem that annoys you or you want to fix a problem. And then it brings this sort of kind of a community, open up, you improve communication skills, you celebrate, if let's say there's a death, it's also an opportunity to talk about, how was your day? Everybody gets to share whatever emotion that they have that particular morning. So it kind of breaks the ice, and everybody is engaging and becomes empathetic to their colleague. And they might understand why that person, if a person starts behaving a certain way during the day, you start understanding, okay, this person is behaving this way because they've had a tough time, or maybe today is their birthday. So I just want to bring that aspect of having systems in place that cuts across, helps to generate that behavior and also the culture of the organization. And that also is help you now to tell your leader to to give feedback. Feedback is the other thing. I mean, if you don't have that good communication, then you'll not really be able to provide the leader that feedback that they need to work on their empathy. Now, coming back, that patients are not commodities. If you really want to make an impact, or the treatment plan that you have for the patient, you want them to recover quickly. But if you're not involving your patient to be part and parcel of that treatment plan, I tell you what, already there's a problem. Either they will not be compliant with whatever you prescribe them, for example, it's medicine, or they will not be even open, they will not open up. There are certain patients, if you're not having that good relationship, or you don't know how to engage them at that level, at the level of emotions, you will fail to really understand what is going on. You might just be dealing with the symptoms of the problem, and you will fail to deal with the root cause of the problem that they have. So really, for the outcome of the recovery of that patient, it's crucial that physicians or nurses or healthcare providers really look at patients not as commodities, but as human beings, and that emotional intelligence is crucial for that process.
I agree. And I think there's a raft of evidence out there which even talk about recovery, which talk about, how many days you stay in a hospital is all predicated on you actually having particularly this empathy. I want to bring in Vicky from Profiles International, East Africa, just to say one or two things about patients as commodities. I think she has an interesting perspective on this. Vicky, would you like to comment?
I'd like to say something.
Yeah, please go.
Actually, I want to comment on two things. The first one was, I think was alluded by Gordon when he said the healthcare profession is one that is filled with a lot of clever people, intelligent people, and a lot of intellectuals. And I'm just going to go back to some research that was done. And what happens is that they're able to get to grasp a lot of the things that were required, that were part of the process of healing, or part of reading about the process of healing. I always like saying that we no longer have to be walking, freed from the fact of having to memorize everything. And so intellect is being replaced by creativity and creative thinking. And so when we are presented with solutions that already have problems that already have almost automated solutions, there's something that Nancy said. She said that the robot will give the data, but the person will sit and start understanding the circumstances around the person so that they can then see what options can they offer these people. Now, there's a lot of research that shows that when you motivate people by how much money they make, it narrows their mind into focusing on how faster, how quickly can they do that work? How quickly can they churn out these things that are supposed to be churned out? But when you release that and you start developing communities where the outcome of the work, not how much people are paid, becomes the main point of judgment, or the main point of understanding that something has, we've done something good, we've provided some value, then people stop feeling that that stress or that need to achieve these numbers and relax and open up and become a bit more creative about how they approach situations, how they approach patients. And I think it's like that for every business and at all levels. As long as you're not involving mechanized work, I go to the shelf, I remove a drug, I bring it here, I write the name. As long as you're involving situations where now you have to start thinking about providing various options to people, then we have to remove the incentive on how many patients you see, and that gives you more bonus, because then that allows people then to operate in a more...
Vicky, I think we may be struggling with your connection. I hope it's not on my end.
No, it's not your end. It's generally,
okay.
she's
All right.
She's breaking up.
All right, Vicky, I think we we got what you said. I just wanted to bring in a few more comments in the chat section. And Zuhura, again, with words of wisdom, saying the challenge is not in the healthcare sector alone. Oh, Vicky, we lost that last part, what we're saying. I think we had problems with your connection. We'll come back to you in a second. I was just bringing up, and I liked what you said. Zuhura was saying that the challenge is not in the healthcare sector alone. We have stopped wearing and walking in the shoes of other people. Now more than ever before, we need to include EI or EQ as an essential training skill in all programs. And this is lacking in our education system. I couldn't agree more. And Vicky Mukiri says there's a richness inherent in possessing attributes such as empathy, warmth, an optimistic explanatory style that neither robots nor computers can compete with. Apparently this touched off because we have quite a few comments here regarding AI. With AI, the challenge will be enforcing medical professional ethics, but AI cannot be underestimated. And Lillian is asking, I'm struggling to understand how AI can implement medical ethics, especially when engaging a client for an informed consent. Panel, over to you.
Sorry, Derek. I just want to comment on how AI can help reach out. I think the whole idea of introducing AI into the health sector and complementing EI is that the reach becomes wider. When I say that, I mean if the patient sitting in Bea and outskirt of the country and they cannot travel all the way to Dar es Salaam, that's where AI complements it, right? Because they can sit in their home where they cannot travel and actually do a consultation with the doctor sitting in Dar es Salaam in the hospital. And this is just Tanzania I'm talking about, but worldwide that is happening so often, where big surgeries are done remotely using AIs, and that piece is something that is going to connect again the reach, affordability, reach, longer reach, higher reach to the patients who cannot reach the big facilities.
Okay, Lillian, I hope that answers your question. Actually, there's an interesting article here that I pulled up, and perhaps everyone can take a look at this at some time. It's called The Rise of Artificial Intelligence Makes Emotional Intelligence More Important. It's an article that was written in the Harvard Business Review a couple of years ago, and we'll put it into the chat so that you can go and you can read it, and has some very fascinating insight into this topic of AI and EI. There's a question here actually that I wanted to ask of Gordon. And Dr. Sheila Masharia says, another reality for women leaders is, and she says this ever so gently, that the male ego, the balance between not being viewed as unnecessarily aggressive and yet squarely taking our place at the table is a continuing art. So what does EI mean here? That obviously goes to our gentleman on the panel. Gordon.
You know, Derek, actually, I enjoy such questions because in the health sector, 85% of the workforce are females. And you tend to find that in a society where ladies are not allowed on the table. My greatest joy was actually working with a senior management team, which was largely, let's say we had all the senior managers in a meeting on a Friday, we'd be maybe 25 or 26. There'd only be maybe 3 or 4 males in that room. My head clinician, myself, my head of finance, and my IT director. All the other managers will be ladies. And so when I hear about other industries trying to empower women to be leaders, I find it strange that outside the health sector, people are not seeing the women excellent leaders as such. And I learned how to work with ladies in a different kind of format, whereby it's not about your ego, it's more about understanding how women get things done. And they easily build consensus around issues. And once they agree, they get on with the job. And it all works very, very, very well. So the ego part came to me differently, is that the women who were exceptionally good as clinicians. They say the ego is a male thing. I actually found out that women have egos. Yeah. I had a very rough time dealing with the feminine egos rather than the male egos. So maybe I needed training on my EI aspects of handling that kind of aspect. So I'd like to encourage the ladies listening in on this show that there is a lot of room for healthcare leadership from females.
Thank you, Gordon. In fact, somebody has commented, DK, Derek, I am a lady, and have you worked under the female ego? Okay. So she says, address ego in general, male or female. So there you go. So another comment here, Yuri Correct, gentleman I know, says, in my experience, I've noticed that many people don't actually lack the capacity for emotional intelligence. In fact, I think most people do have a high degree of EI. Is that right, Yuri? Unfortunately, many of them are held back from using their innate emotional intelligence by a collection of bad habits. How can we drop these bad habits? How can we change, panel? What say you?
Maybe you should give
Anybody can pick that up. Anyone on the panel?
Derek, I think I want to make a comment there.
Go ahead. Yeah.
When you think about emotional intelligence, and I know you refer to the Geno's model, it's how we show up. I mean, and how we show up in terms of what is it that we exude. And when we show up, how is it that you're making other people feel? And I don't know if I'm overemphasizing the aspect of self-awareness and awareness of others, but it has to start with us as individuals being very conscious of how we are showing up and how our behavior or our responses or lack of them are affecting other people that are around us, and how our own feelings are impacting on the decisions that we are making. Because when I think about emotional intelligence, I also see it as the interaction between our emotional brain and our rational brain, such that there has to be a balance between the two. So it starts, I would say that it starts with us as individuals, and we have to be very conscious in creating the environment that we'd want others to create for us, because it is proven in emotional intelligence that the way we make others feel, it impacts on how they respond, and how they respond, inevitably, it impacts on their productivity. Because the human nature is said to have two states. And in these two states, there's a threat response, which then makes someone be more narrow-minded and respond in a way as if they're responding to danger. I mean, they don't become creative. But on the other hand, when there are positive emotions and what we elicit in others is positive, they tend to be a bit more creative, and they open up, they become more productive, they become more engaged. So it needs to start with us as individuals in whatever space that we occupy, whether we are in leadership or not in leadership positions.
Thank you for that answer. Well explained. Folks, we have 10 minutes left. It is 5:20. I'm now going to ask our panel to give us their final thoughts and to make the case for emotional intelligence in the healthcare industry. I'm going to give you 2 minutes each. We'll start with you, Brenda.
Thank you, Derek. I think most of it has already been said. And I think it was, even though there's 4 of us, but we all talked about it in different angles. And I'm so glad that we have this very well-rounded and great questions as well from the audience. I would like to say thank you for being part of this amazing team of panelists, and just to emphasize the role of EQ in healthcare, but also where does it start? It starts from recruitment. Yeah. How are we recruiting the people that are coming to work in our organizations? Because it has clearly been said, you might be very highly skilled, very highly intellect, but if you're missing those a very important social skill of emotional intelligence, you might be having a team that is not delivering your mission or your objectives of your organization. So if already you have take time and invest in emotional intelligence, take time and have open conversations about this, because it's still, even though we talk about it, but it's still new. So for me, I cannot speak enough on how important this is, especially in the organizations that I work for, because we are preventing disability. We have the clientele that we have. It is key to have this skill. So thank you very much for the opportunity.
Well said, Brenda. Thank you so much for your insight. Mili, what is your final thoughts on this important topic of emotional intelligence in the healthcare industry?
Thank you, Derek. I think lots have been said, as Brenda mentioned, and I think all amazing panelists have said a lot of different perspective of emotional intelligence, and of course, thank you to all the fantastic questions and discussions. From my side, I think emotional intelligence is even more important than performance or qualification. I think that's my take. Also, emotional intelligence is still very new, and I think Zuhra mentioned that very well in one of the comments she put there. Is training is very critical. Emotional intelligence needs to be it's so new that we all needs to be trained and developed. Somewhere or the other when we come into the world, when we're born, we are with it, but then our brains needs to be trained, and that is very, very critical to have emotional intelligent impact on wherever we are working. Investing our times as leaders, I think we need to also invest in emotional intelligence. That is very critical, and I think I mentioned this earlier, but the research shows that 80% of the success in the organizations depends on EI. So I think that would be my last take, especially in the health industry, where we are dealing with emotions, where we're dealing with patients, and we with during the COVID era and after the COVID era, I think we are going to have this huge pool of emotions that are going to go on. And all I could say is let's invest in it and let's keep training ourselves.
Mili Rughani, thank you. Awesome. I love that that summation. All right, Nancy, just in case there's still skeptics on this call who are like, really, EI in the healthcare? You have 2 minutes to make your case.
Thank you, Derek. I think we quoted the World Economic Forum, which predicted that AI would be among the top 10 skills. I think it rated number 6 in 2020 to be able to thrive in the 4th industrial revolution. And I think that has even been quickened by the advent of COVID, where social interaction is being minimized. AI is coming more rapidly than we thought, even in healthcare. And in talking about then the need for us to be emotionally intelligent, there's this quote that is famous by someone by the name Maya, which talks about people will forget about what you said and people will forget what you did, but people will never forget about how you made them feel. And we have said in this conversation that the good thing about emotional intelligence and like IQ is that it can be learned. And we can be able to improve, and everyone listening to me can be able to improve and to build on their emotional intelligence. And I want to sum it in this manner. Think about the best ever boss that you've ever had, and also think about the worst ever boss that you have ever had. And when you think about the best ever boss that you've ever had, or the worst one, how is it that they made you feel? And after you have figured that out, then be the manager, or be the boss, or be the co-worker that you'd want to see. I think Obama says it very well, and I want to quote him again. And he said that change will not come if we wait for some other person, or if we wait for some other time. We are the ones we have been waiting for. We are the change that we want. So go and be the manager or be the co-worker who is aware of themselves and aware of others and able to make the right decisions. Go ahead and start with yourself and be the change that you want to be. It can be done, it can be learned. It can be learned. Thank
Fantastic. Nancy, I love the Maya Angelou quote and your summation was awesome. All right, Gordon, if you could go back 20 years and talk to your younger self and you were telling them about this emotional intelligence as you're entering the healthcare industry, in 2 minutes, what would you say?
I think, Derek, thank you for being an excellent host for us and for Profiles International to bring this very enjoyable topic. And to your points, if I was much younger and 20 years ago, I would say emotional intelligence would help me avoid burnout, which would be caused by high levels of anxiety and stress and trauma. For me, who's working in the healthcare industry. Most importantly is that I would try and raise my level of self-awareness. And by that, I would try as much as possible not to be very personal in terms of the decisions I would be making. And by that, help me. And then really critical was mastery of my communication skills. And by that, it would really help me in terms of building of trust and enhance all the change efforts that I have in my organization. And early enough, would try and have transformative programs to bring about EI to the fronts of the organizations through training. I think that's the way I would sum it up, Derek.
Thank you. Thank you so much for that, Gordon. And indeed, thank you to our entire panel. I mean, truly, this was an eye-opening conversation. As you can see in the comments, great insights, very insightful. As a recent graduate, I think this is an insightful conversation. Zuhura, again, training. And there's a comment here from Mathangani. I have some interaction with healthcare leadership as HR. The patient care and clinical outcomes are closely related to patient clinical officer interaction. EI was and continues to be a critical aspect and irreplaceable in patient relationship. However, clinical staff are well-trained. The issues progressive decline in medical ethics, riding on a lack of training in communication, a detachment from care revenue. So I suggest a back to basics focus. Otherwise, great topic. And I think our panelists, all of them touched on all of these. So thank you for your comments, everybody. And once again, to thank our STEAM panel, Nancy Mwabili, Chief HR Officer at the Nairobi Women's Hospital and a certified Genos practitioner, Gordon Odundo, 20 years as a top executive in the healthcare industry, your insights, particularly from a leadership perspective. Brenda, awesome. I loved your take. And of course, you are with the Tanzania or the CEO of Comprehensive Community-Based Rehabilitation, CCBRT, Tanzania, and Mili, Head of Business Development at the Aga Khan Hospital. Awesome, guys. Thank you very much. And thank you so much to you, our audience, for participating. I'm actually going to hand over to Vicky, who will do the final wrap up. It's a wrap from me.
I think we need to say thank you to
Thank
Derek
you.
as well.
Yes,
thank you,
Derek.
Thank you.
Thank you.
Thank you.
I hope my internet is behaving now, and I'd like to say thank you very much to the panelists. It's been a real joy watching this, and I think the insights are fascinating. The beauty about such conversations is that they're coming from points of experience, and so like an older person to a younger person, as Gordon did it. And I think we must remember, even if early stages of EI, we have the early adopters who already see the value in it, but it's the message that must go so that even the guys now who later on join can start to understand, as someone said, that EI actually makes a difference in how you progress in terms of your career, because it alleviates stress, it reduces anxiety, it enables you to tap into relationships, and things that are very key in moving forward in life. Other than that, I wish you all a great evening, and thank you very much for being part of this discussion. God bless you all.
Thank you, Vicky. It was great. Bye.
Bye-bye. Thank
Bye.
you.
Goodbye, everybody. God bless and have an emotionally intelligent weekend. Please.